Good evening. Welcome to Liberty and Justice for All. This is going to be kind of a follow-up to the last show because we never really got to talk about what Dr. Lee does for all of us. And it's naturopathic medicine, and that's what we're going to talk about tonight. You hear all kinds of things bannered around alternative medicine, and underneath that banner is all kinds of different things. Homeopathy, hypnotism. Everybody's got some wrinkle on alternative medicine. Well, actually, alternative medicine isn't alternative to me. It's regular medicine because it's you healing yourself. But tonight, we're going to focus on naturopathic medicine. Dr. Thomas Lee has graciously came in tonight again to tell us what it is and what it is he does, basically. Dr. Lee, thank you so much.
Well, thank you for having me.
I'm going to right for the throat. What is naturopathic medicine?
Well, you had a lot of different opinions about that around the world right now.
Yours.
Well, in my opinion, it's a old American philosophy of medicine that comes from about 100 years ago, and it was practiced widely in the New York Eastern Seaboard area at the turn of the century. There's a lot of immigrants coming from Europe in those days, and Europe had a very wide, varied philosophy of medicine and healing. And in America, there was a varied landscape of types of healers. You talk about many things being available now. Well, you had doctors doing hygiene medicine called Nature Cure. You had people doing hydrotherapy, treating people just with water. And they had one called a sanipractor, and sanipractors were dealing with the sanitation aspects of treating a community by keeping things clean and so forth. Anyway, there's all these various strange approaches, including homeopathy, and including the then very not super widely known study called allopathy, which became the darling of the pharmaceutical industry because they recommended using a lot of drugs, and drugs are expensive, and they made a lot of money with that. However, in that early landscape, the naturopaths federated around a gentleman named Benedict Lust, and Benedict put together a group of these different philosophies of medicine generalized and called naturopathic. And it was pretty much of a small and growing interest up until primarily around antibiotic time, when just around World War II, when it was very impractical to spend a lot of time and energy in healing, when a pill would take care of the deal, cure the problem. Why not give people a pill? Well, and the older doctors started to sort of go with the program and leave behind the more time-consuming real healing.
But into your office, and I say, Dr. Lee, I know what happened if I went to an allopathic doctor. It's a bottle of antibiotics of some sort, and go home and rest and drink orange juice and, you know, watch TV. If I come into you and I say, somebody drove a railroad spike through one lung, it really kind of hurts, how would you approach that?
Well, I would approach it like I'm trained to do in medicine, be it naturopathic or allopathic. First, you want to try to understand what's happening with the patient. So you do things like analyze the situation. If they have an x-ray, you take an x-ray and look at it. Or if you have an exam, you listen to the lung and try to locate where the problem is. You do whatever you could, maybe some blood tests if there was a long-term situation that led up to it. Whatever would help me understand you quickly would be what I'd try to bring to bear, to have something to offer to treat the pharmaceutical representative and saying, we need the most appropriate antibiotic to use in this case for a short period of time to get him through this procedure. Now, I wouldn't be practicing a different philosophy of medicine by using the drug. I'd be practicing naturopathic medicine if I was using whatever I used to try to understand the context and treating the cause of that disease rather than just your soreness in the
You're going to find out what caused the problem.
Right. And try to understand what should not continue and what should change in order to make the problem go away.
Right.
And that's the point with a different philosophy of medicine. Now, there's many different outlooks as to what people like for medicine. America is a land of immigrants and people from elsewhere, and many different philosophies of medicine are practiced elsewhere in the world. And it's reasonable to me, anyway, that America would represent a variety of choices for somebody that wanted to understand their health challenges from other systems of thought and methodology. And this is what's taking place really around the world. It's a kind of a world medicine that's emerging. And it's not all about one is really wrong and one is really right. It's more options and more possibilities.
They're all different. They have different backgrounds, they have different sizes and shapes, different genders, different everything. And so there is no one thing. It takes a trained professional to do what you're saying you do, which of course you do, but you're looking for what caused the problem.
Right. And America is, like you say, a diverse place and a creative place and a very health challenged place generally, increasingly so because of many factors we don't even need to discuss. And it's reasonable to me that if you're a physician treating somebody's problems, then philosophy of medicine and the orientation you start out with is wonderful, but you find that as the years go by, most really good doctors that are trying and paying attention, they want to get a bigger and better tool chest of medicines and drugs and procedures and complementary philosophies that they can all bring to bear for the very tricky cases that come into their
But what you're saying to me also, I can see another problem. First of all, you know, lately I've heard all kinds of different things about naturopathic medicine and all of the alternative medicines. Why is there a controversy around it now? Well, I mean, who questions natural healing? I mean, think about naturopathic. It comes from the word nature. I mean, that's why, how can anybody not understand nature?
Well, once the term has become commercialized and profitalized, and it's on every can of everything that's in the store jumping out at you, it stops being a definitive and it starts to be just another piece of static on the advertising board.
It's okay.
If it gets to a difference in philosophy, I really don't have as much of a challenge talking to a well-trained and experienced physician of another philosophy as I do an opinionated and accountant for a hospital that wants both of us to grind our probabilities into something that predicts what they can make a profit off.
They'll be back soon. And there's been so much written by Dr. Bogdanovich, wrote the book, The Cure is in the Cause. And what you're saying is exactly true. Find the cause, you've got the cure.
Mm-hmm.
So that's it. Is that naturopathic medicine in a nutshell?
In a really big nutshell, okay.
Yeah.
But naturopathic medicine is a very diverse and colorful history that I would like to communicate most to people if they would take the time and inform themselves about the world of their parents and grandparents and see that our American birthright is an extremely creative and compassionate and well-informed effort to help people live healthier, longer, and cleaner lives. And the diversity of medical care solutions, the diversity of educational opportunities, the diversity of lifestyle choices and exercise patterns. These are where we come from, and where we're going to isn't so much about what is naturopathic medicine. It's more about who the heck are you? You know, what's your American life about?
Right.
What do you stand for, and what do you come from as a choice to bring a better future to our world and to our kids' generation?
Right.
I remember a discussion we had in my profession a few years back, which was, okay, so you know, there's only maybe 4 or 5 major naturopathic colleges producing medical physicians using naturopathic medicine, and maybe there's 2,500, 3,000 people in the country at my level of training tops. Okay. What happens if 1% or 2% of the American public decide, hey, that's what I want to go with? how can I meet those guys and meet my needs? We're swamped right there, right?
Right.
But if you're going to discuss anything about where healthcare has to go in the future, and you made a list of the features that would have to be happening, appropriate medicines, responsible decisions on the part of the person, you know, ability to personally choose a lifestyle that is helpful towards other people and doesn't use the resources around you. You made a list of these features of a working healthcare system. You could call it whatever the heck, but it would be essentially what the naturopathic medicine model is trying to teach, okay? And we're not, you know, it's not a matter of trying to own the terminology. It's a matter of what is the public going to create in the near future if it's going to take care of these needs rather than just tank and go down towards something unacceptable. Doctor I know started out as not one. And what brought us to an interest in this philosophy of medicine was generally some confrontation with the laws of nature that left us wide open and curious about how the heck we got to that position. And so generally, depending on the age at which this realization took place and the person's flexibility of environment, we were able to make a concentrated study of what seems to be the natural law of health, and the laws that nature puts out for, you know, use of good clean air, water, light, exercise, stuff that, you know, individually it doesn't seem so complex, but for some reason it's really rare that people sort of put it together on their own and appreciate how valuable the mixture of resources are that we can categorize as natural medicine.
And this is your health. This is your life. This is your family's life. If you don't want to think of yourself, think of your family. To work with somebody like Dr. Lee and many of the other doctors, fine doctors we've had on this program, to make yourself healthy, to heal yourself. So isn't that what you do? Don't you teach people to heal themselves?
I try.
Give them a little help?
I try. I think that many times people are driven to go to the doctor in the last moments of panic and despair, and I would prefer that it be on a non-panic, non-despair level of what are some good choices you can make to go to a better place, and let's not hurry about it, and we don't have to, you know, bankrupt the family estate in order to do that, but it does require proaction and discipline on your part to pay attention, turn the TV off, read something, you know, take a choice, depart from a certain diet and go towards another one. I would see a much better outcome if people were oriented in that direction.
How'd you get into this?
Oh, well, I had some misunderstandings with how to have fun in the 60s that took me a good part of the 70s to correct and orient into my life. And in that process, I started finding that there are these strange birds up in the hills in the Northwest that were actually paid by other people because they were so good at the things that I thought was fun. And so I started looking around and seeing that they went to a college and had some training and knew a lot more about the things that I'd been exploring on my own. And I ran into some of the founders and originators of a college in Seattle called the Bastyr, or John Bastyr College. And I got myself tidied up some academics that were fluttering in the wind. And I got into a class there and started to make a lot of friends and realized that it had been something I'd been looking for a long time. And it provided it was a kind of a financial train wreck to go from being a well-paid construction worker into strange alternative medicine. But it was definitely rewarding, and the soul work aspect of it was such that I literally couldn't afford to go back into conventional career mode and have to pay for all the recreational alternative distortion that was necessary to make that go. So I got into it because I met some very, very interesting people and had the good luck and fortune to be inspired and mentored by some of the geniuses of our age. Some of the I knew Bill Turska, who was one of the last surviving members of the eclectic physician tradition, which the eclectics were the people that were the people that took herbal medicine from the Indians in the 1800s and put it into hospital research, European-style research mode. And they died off with a lot of alternative medicine around between the wars as politics marched onward.
Yeah.
And Bill Turska was one of the founders of the Naturopathic College in Portland, and he was a personal friend and mentor and quite a genius of an old Finn. And it was through inspiration with those people and my own studies that I became very interested in this. Aren't humans interesting? I mean, there's so many different kinds of motivation that you can see. If you didn't have disease, if you didn't have illness and suffering, and you wanted humans to get smarter and better and stronger, you'd have to invent it, because there'd have to be some kind of negative consequence to making wrong decisions. So along comes a naturopath or an osteopathic doctor or an allopath, any philosophy of medicine. First, do no harm. Okay, so you don't want to hurt somebody, but what if what they're doing that's negative and hurtful to them is actually in their best interest, because they're going to hit bottom and they're going to turn around and view things in a more mature and reasonable way, and maybe teach their family and friends and make a tremendous impact in the future from this real sack of lemons of their present lifestyle. It's a real confusing kind of technical aspect of being a doctor.
In naturopathic medicine, do you get into a realm of spirituality with people? Do you kind of incorporate that, or is it?
Well, I think anybody that is committed to working on the human experience to the betterment of that experience has to acknowledge, and quickly so, that we are other than a water balloon. You know? We've got some aspect of us that isn't just the meat, it's the spirit and the soul, the karma, you name it.
And
everybody's got a different name for it.
And it has to work together.
But it's a dimension or an aspect of a conscious human that is clearly important and valuable as to whether they're going to be sick as a dog on Friday or flying high on Thursday night, you know. And where they go with that life view and their personal philosophy, you can call it a soul. I can call it a, you know.
You can put any name you want on it. But it's, to me, it's a spirituality. It's not. We're not talking about religion here. We're talking about spirituality, the human, the spark of life. Well, there's all kinds of names.
I touched on it earlier when you asked about, am I lucky to be dealing with the type of people that are aware and in charge of their decisions in their life. And a friend of mine and I were speaking a few years back, and the term he coined that I like is transformative medicine, not naturopathic or allopathic. It's a matter of I am motivated and inspired by medicine as a science and a tool or a technology to transform and improve a life. And that doesn't limit itself to, hey, my foot works better and I can wear those sneakers, you know, faster than the guy next door. It has to do with people that are acknowledging and in process of change in their life. And that isn't the majority of people. It just isn't. So I long ago stopped being conflicted and upset that there were many people I couldn't communicate with, because it's just clearly evident that for most people, being comfortable and being steady and having things dialed in and the right TV shows to watch, that's really their value system. And I'm not the guy that's going to spend my life trying to change their values. What you're talking about that's exciting, and I agree, is that maybe it's because we got so much on the negative side to work with now, but collectively there seems to be a bit of a shift in the national or public awareness that these technologies of transformative medicine, of personal awareness, of taking responsibility and becoming a participant in your life, are really up for us now. And that's where that diversity that you're talking about being so confused at the beginning was, that's where it's coming from.